Alzheimer's disease accounts for the largest proportion of dementia cases. A major transformation is currently underway in the field of its treatment. The U.S. Food and Drug Administration, FDA, has approved LEQEMBI IQLIK, a new method of administering the Alzheimer's drug LEQEMBI, generic name lecanemab. This news has the potential to overturn conventional wisdom regarding dementia treatment and significantly transform the daily lives of patients and their families. In this video, we will provide a detailed explanation, based on objective medical data, of this new therapeutic drug's efficacy and mechanism, potential side effects to watch for, and its broader impact on the medical community and society, as well as future prospects. First, let's look at what kind of drug LEQEMBI IQLIK is, along with its efficacy and mechanism. One of the primary causes of Alzheimer's disease is the accumulation of an abnormal protein called amyloid beta, A-beta, within the brain. It is believed that this protein damages nerve cells. It is believed that this amyloid beta damages nerve cells and causes brain atrophy, leading to a decline in cognitive function. LEQEMBI is an anti-amyloid beta antibody drug designed to target this protein. It specifically targets and binds to substances known as protofibrils. Specifically, it targets and binds to protofibrils, a stage occurring before amyloid beta forms large clumps and the stage considered most damaging, and removes them from the brain. Data from the large-scale clinical trial Clarity AD demonstrated significant benefits. Data from the trial conducted by developers Eisai and Biogen demonstrated that administering LEQEMBI slowed the decline in cognitive function by 27%. This 27% reduction was observed over an 18-month period. While it is not a magic bullet that completely cures the disease, it has shown significant benefits by delaying the progression of symptoms by approximately 7 months and extending independent living. And the most distinctive feature of the newly approved IQLIK formulation is its method of administration. Previously, LEQEMBI required intravenous infusion. The previous method required an intravenous infusion at a medical facility once every 2 weeks, a process taking about 1 hour. However, IQLIK utilizes a subcutaneous injection method, meaning it is injected directly under the skin. It can be performed quickly at home. By using an auto-injector similar to those for insulin, administration can be performed at home just once a week, reducing hospital strain. While this therapeutic drug holds promise for groundbreaking results, there are specific side effects and risks that patients must be aware of. The phenomenon requiring the most attention is known as ARIA, amyloid-related imaging abnormalities. This occurs during the clearing process. There are 2 main types: ARIA-E, which involves mild brain swelling, and ARIA-H, which involves microhemorrhages or ion deposits. Clinical trial data indicates that many cases of ARIA are asymptomatic. They are detected through routine MRI scans and resolve naturally over time. However, some patients may experience symptoms such as headache, dizziness, confusion, or visual disturbances. Severe cases are rare. Research indicates a higher frequency of severe ARIA in certain groups, specifically patients with 2 copies of the APOE4 gene. Additionally, patients taking anticoagulants, blood thinners, may face an increased risk of cerebral hemorrhage. Proper screening is vital. Side effects specific to subcutaneous injection include localized skin reactions at the injection site, such as redness, swelling, and pain. Proper self-injection technique at home, and a system for promptly contacting a medical facility if abnormalities arise are essential. So, what changes will the arrival of LEQEMBI IQLIK bring to society? First is the improvement in the quality of life for patients and caregivers. Visiting a clinic every 2 weeks placed an immense burden on elderly patients and caregivers. Shifting to home injection dramatically increases freedom. It also holds the potential to reduce the risk of family members leaving the workforce to provide care, a significant societal benefit. Second is the optimization of medical resources. Administering infusions required hospital beds and staff, limiting facility capacity. This raised concerns about disparities in access, particularly for rural patients. Subcutaneous injection enables more patients across regions to receive care. However, this also gives rise to a new challenge: ensuring the quality of safety management outside the hospital setting. It is more important than ever to establish a community-based monitoring system where practitioners and specialists collaborate closely. We also cannot ignore the economic aspect. Amyloid-targeting drugs come with a very high price tag, impacting healthcare finances. Given the vast number of patients, there is ongoing debate about whether widespread adoption will place an undue burden on national budgets. Finally, let us summarize the future outlook. The approval of LEQEMBI has solidified a major trend: the shift towards subcutaneous injections. Research is advancing further, including technologies to detect signs of Alzheimer's at an extremely early stage via simple blood tests. Other advancements include the development of new drugs that target not only amyloid beta, but also tau protein, another substance in the disease. In the future, we may see an era where risks are identified during routine tests and dementia is prevented through injections before symptoms appear. Alzheimer's disease is no longer a condition where a diagnosis spells the end. It is transforming into a disease that can be properly managed. This allows patients to slow progression and continue living life on their own terms for a long time. This drug represents a significant step. To fully benefit from these advancements, it is essential to be well informed, understand the risks, and maintain a connection with medical systems. Thank you for watching. If you found this video helpful, please subscribe to our channel and give us a like. Medical Insights with Dr. Joe Jingi. See you soon. Goodbye, Zaijian.